Get tooth decay, right, Margie?
That's never a good thing, John, that's for sure. We're talking about Halloween. It's for tricks and treats, so now a very good time to remember our oral health. Dr. Stefan Zweig is the president of the American Association of Endodontists, and he's with us this morning with a few reminders for you. Good morning to you.
Thanks, Margie.
Yeah, good to have you. First of all, explain what is the difference between a dentist and an endodontist?
So an endodontist is a dentist who receives special training, about 2 years of extra training to learn how to do root canals and to save natural teeth.
All right, so when we're talking about saving natural teeth, we're going to talk about like cracked teeth, root canals, like you mentioned. Sure. How do you know if your tooth is cracked?
Well, usually when you have a cracked tooth, there's some type of pain involved, and a lot of times it's pain on biting. But other times you can get spontaneous kind of pain, just a tooth that starts to hurt, and sometimes there's an event that can crack your tooth, like you might have bitten down on something really hard, like a piece of candy. Or other times it comes from stress and grinding of teeth over long periods of time.
A lot of people do that when they're sleeping.
Absolutely, and we're seeing a lot more of that now than we ever have, and we're not exactly sure why, but we hypothesize. We think that maybe it's because people are under more stress, especially during this COVID pandemic. So we're seeing a lot more cracked teeth.
That was the first thing that came to mind when you said that, right? Absolutely. When we talk about root canals, so many people are like, oh no, it's the worst thing, but it doesn't have to be.
Absolutely not. So root canals are procedures that actually help save teeth, and so a lot of times people are in pain before they come, but most of the time we relieve their pain very easily. And what we're finding also is that through some of the surveys that we've run is that when people go to endodontists who are specialists in doing root canal, they actually have better experience in having root canal. And root canals can be done usually in one visit with absolutely no pain.
And then you're coming out of it. Obviously, you've been in pretty excruciating pain before that.
A lot of times, yes, yes.
Absolutely. What should people do before they can get in to see a dentist or an endodontist?
Well, of course, you want to take care of your teeth, and that includes, home care, like brushing every day, at least twice a day, flossing, and really avoiding eating hard foods. And especially around this time of year, if you're going to be eating candy, to make sure that you brush after you eat the candy. But it's also important to see your dentist, and we advise most people to see their dentist at least a couple times a year for cleanings and checkups.
And during the pandemic, a lot of people missed those appointments. They kind of put them on hold. How can they get back on track?
Well, I mean, dentists are open now, and I don't want to say the pandemic is over, but dentists are back in business, and so it's easy to get see your dentist, and you should definitely do that.
I know my dentist has been very busy since the pandemic, so shout out to Dr. Dankowski this morning. I'll be going to see him actually in a couple of weeks. Thank you so much for your time this morning.
Thanks, Margie.
Yeah, absolutely. Dr. Zweig, thank you.